Your reaction to what we're watching, what we're seeing in India right now?
Todd, the situation in India is nothing short of catastrophic. There are 300,000 reported daily new cases. The true number is probably closer to a million. The health system is on the brink of collapse. There are thousands of sick, dying people, people that are dying, not just deaths, but really terrible deaths. Crematoria can't keep up. It's a disaster.
How did it get to this point?
I think there are really four things that brought India to this point. The first is complacency on the part of the general public who thought that the pandemic was behind them, so there was no pretense at masking or social distancing. The second thing is just a government failure to build capacity when it had the chance to, when the curve was relatively flat. The third thing was these super spreader events, cricket matches, that thankfully they just closed down, but also political rallies, religious festivals. And finally, as you mentioned, there are new variants that are thought to be much more virulent than older variants.
It's interesting, too, that the decision was made, perhaps as a gesture of vaccine diplomacy, to ship tens of millions of doses out of India to other countries, doses of vaccines, which, of course, now we see could have been used to great effect within India itself.
Yeah, that was just, I think, an act of complete hubris at a time when people genuinely thought that India had somehow miraculously vanquished this pandemic and magnanimously sent the vaccines overseas, including, among other places, to Canada.
We were listening to an expert a moment ago before we brought you into the conversation who, and I'm paraphrasing, said something to the effect that, a lot of government officials he's been speaking to seem to think that this too will pass, that they're following these models and they think that within a few weeks the situation will normalize again. I mean, is that delusional?
Delusional doesn't begin to describe what that is. That is an absolute recipe for disaster. If the scenes that are unfolding before our eyes are not enough to make us wake up, to make India wake up, and frankly the rest of the world as well, then I don't know what to say.
What can be done, Raji, do you think, in sort of the here and now to try and at least somewhat alleviate the situation?
I think two things need to be done, and both of these things need to be done on parallel tracks. The first is simply the emergency response to the situation, which means tending to the sick and the dying, allowing the sick to, or the dying to die dignified deaths, if that's inevitable, while trying to tamp down the spread of the virus using the measures that we're familiar with: social distancing, masking, while, and this is the tricky part, in India, also making sure that the poor, who will suffer immensely from lockdown, have some sort of safety net. So that's really the first thing, the emergency response. The second thing that we cannot afford to lose track of is the fact that if we don't ramp up vaccine production, and if we don't unleash a massive global campaign to get the world vaccinated, we're never going to be rid of this pandemic.
Raji, thank you for taking the time to come on CTV News today and talk to us a little bit about the situation and your insights as well to how to mitigate this disaster we're following in India.
Thank you so much for having me, Todd.
Raji Jayaraman joining us from Toronto with the Munk School of Global Affairs.